This is a legal case analysis of medical negligence, Cynthia Day versus University of Cincinnati. The case background is that it's regarding a woman by the name of Cynthia Day. She filed a claim in the Court of Claims of Ohio for medical negligence. Her symptoms started June 28, 2006. The symptoms, according to Day, started 2 to 3 weeks prior and were intermittent. At times, pain would start in her back, radiate to her chest, down her left arm, and would make breathing difficult, which then spiraled into more pain with heavier breathing. Day was at high risk for acute coronary syndrome, better known as ACS, and was moved to the emergency room. That night in the emergency room, her temperature was 99.3, her heart rate was 140, and her blood pressure, along with blood sugar levels, were elevated. She was seen and treated by the attending physician, David C. Lee, MD, who treated her initially. He thought that she was just suffering from an infection or thyroid issues, ordered her some medication, ordered lab work, and a series of diagnostic tests to be completed. She was taken, and like I said, she was treated at the Clinton Memorial Hospital, and she was treated in their emergency room. She was admitted to Clinton Memorial for further monitoring, observation, and testing. The exams and testing were completed, and the next morning, June 29, 2006, she was seen by Jennifer Bain, MD, an attending physician on duty that morning as well, and a first-year resident at the University of Cincinnati Family Practice residency program. She conducted a physical exam, took a day's temperature, which at the time was still elevated. And on that morning, after some additional testing, she had a CAT scan done, which was ordered to rule out a brain aneurysm, along with a CT scan of her abdomen to review her liver. More lab work, and a thyroid test again was ordered, which was noted to be done on an outpatient basis. She was discharged from Clinton Memorial on June 29, 2006 at 5 p.m. She was instructed at that time to follow up with her primary care physician, Dr. Leah Avira. On July 1st, 2006, she was able to catch up with her physician via the telephone. At that time, again, Dr. Avera advised her to go to the Middletown Regional Hospital. At Middletown Regional Hospital, Miss Day was treated by Dr. Tai Yang, MD. More chest scans were ordered for her CT. Medical records had tried to be obtained from the Clinton Memorial Hospital, where she was recently visited, but record departments were closed for the weekend. Again, Miss Day was discharged and advised to follow up with her primary care physician and prescribed pain medication. Again, Dr. Wynn just said on his medical records, it seems that Miss Day's problem may have been more or so either some kind of infectious process or possible a thyroid abnormality. On July 1st, 2006, lab results from Clinton Memorial came to a resident on duty. The blood work was positive for Staphylococcus aureus, a bacterial infection. Later discovered, neither the resident nor the attending physician, Dr. Bain, advised the patient or the primary care physician of these results. Miss Day, post her discharge at Middletown, could not get an appointment quickly enough to follow up with her primary care physician, Dr. Avera. Finally, she got an appointment with her primary care physician for July 5th, 2006. The evening prior, July 4th, 2006, Miss Day, the patient, had worse symptoms. Now, her worst symptoms that she stated were flu-like symptoms, where her fever was elevated again. She was falling, forgetting things, and she even dropped certain things. By the time her appointment came on July 5th, 2006, with the primary care physician, Dr. Rivera, she could barely walk. Dr. Rivera admitted Miss Aday to Middletown Regional Hospital. Miss Aday's symptoms got worse, and when she, at this point, was having paralysis of her legs and her lower extremities. The MRI that Dr. Rivera ordered revealed a spinal epidural abscess, which is a rare and infectious disease. Diagnosis came 1 week after her initial admission to Clinton Memorial Hospital. On July 6, 2006, Miss Aday had neurosurgery to decompress the T1 through T6 of her spine and for removal of the epidural access. Miss Aday was treated in the hospital post-surgery. She was there and treated until July 18, 2006. Since the diagnosis and from the results of her symptoms as they progressed, she is now a complete paraplegic. In addition, she suffered loss of her bladder and bowel functions. In October of 2007, Cynthia Aday filed a medical malpractice lawsuit against the University of Cincinnati and several of their residents, Dr. Bain being one of them. She felt that Miss Aday felt that Dr. Bain overlooked her testing, or even the test should have been ordered and relayed back of the information to her, was the sole reason for her damages and suffering. The Adays had a prior case open with the Court of Claims against Clinton Memorial. That case was still pending, and as it closed, she was actually awarded roughly $2 million from Clinton Memorial Hospital for their negligence and damages. The trial was conducted by the Court of Claims for Liabilities from August 23rd to the 25th of 2010. On June 1st, 2011, the Court of Claims found in favor of the Adays. The court denied the request for any partial directed verdict, and her final verdict came on April 6, 2012, when the Adays were awarded $3,311,761.84 for damages from the University of Cincinnati. This trial was actually an appeals trial to the initial one by the University of Cincinnati. They had argued that there were several points and errors made during the trial, and they appealed the decisions made by the trial courts to the Court of Claims of Ohio in favor of the Adays. The UC had claimed errors with the expert witnesses that were testimonying, a set-off rule that had basically stated that these were that Miss Aday had actually received benefits prior from Clinton Memorial, so they were not required to pay her more. And there were different interpretations of the statutes that were coming down in the trial, and they felt they didn't have to pay her for lost income because she was a farmer and she worked on the farm and she technically didn't have a salary. She didn't bring any of the farm documents and income to the trial. However, they had hired an expert economics person to come to the court to testimony and give witness to the fact that she had, even though she wasn't collecting a salary, she was still working, and prior to her injuries, she was working 40 to 50 hours a week. Now, she was lucky enough if she could work 4 to 4.5 hours a week. It was finally decided that the trial courts reviewed everything. They had gone over the Court of Appeals, and they overruled and discredited all of the University of Cincinnati's arguments. And the Court of Claims in Ohio actually agreed with the judgment that was given initially to Miss Aday. So why is this important to the medical field? Why is this case relevant? Why does it matter? This case to me is important for several reasons. First of all, to see the errors and mistakes of the case and making sure that people don't make those mistakes. To remain diligent and detailed. Are all your tests ordered? Did you review all your results? Did you let someone know of these results to let the client or patient know this information? That to me was a very important thing, is that no one seemed to pay attention to her symptoms. They just kept pushing her off and discharging her. Seeing how many errors they can have, or how many errors took place in this case, puts the reputation of the hospital at risk, and obviously you can tell they took a financial loss for doing so.